Turning now to the United States, there's promising news for the Affordable Care Act. Millions of Americans saw a key self-imposed deadline set by President Obama for the healthcare.gov website reached over the weekend. The agency in charge of the troubled website says that the worst of the online glitches and bugs should be over. To explain the progress the government has made on the Affordable Care site is Errol Pierre of Health First, a not-for-profit care organization. And Errol, you have been with us all along the way as we've talked about this. Welcome back.
Thank you.
Good to see you. Good to see you. Now, Jeff Zients said this. He said the bottom line, healthcare.gov on December 1st is day and night from where it was on October 1st. So improvement is expected, but give us a report card. How much progress has the government really made to fix these problems? Sure.
We have sales folks on the ground, so we're hearing right from them directly. Since October to now, definitely change. The click-throughs are faster. It takes you faster to get from one page to another page. Validation of who you are. So when you go on the site to type in your information, and it has to go out to something called a federal hub to see if you are who you say you are, that process has been faster. But the big, I think, information that needs to be widely distributed is the website fix for healthcare.gov is about 36 states. These are the federal exchanges. These were the states where the governor said, I'm not going to build my own marketplace or my own exchange. And Washington, D.C. had to go into those states and build it themselves. The vast majority of the other states that have either chosen to do their own, like New York or California, or New Hampshire, which has done a hybrid, some federal, some state, those have been working better than the federal. So sometimes you hear these things about the glitches. The federal states have been having more of the glitches than the state-specific ones.
Even with these improvements, what the government has said is, what the U.S. government has said, the Obama administration, is that now the website as it stands can handle about 50,000 users at any one time, about 800,000 a day. But of course, the key for this whole program to work is for people to sign up.
Correct.
And of course, we have the deadline that's coming up. It's been extended, but it's coming up for those who want to get coverage by January 1st. So the question is, will the website be able to handle the volume necessary to make the law work?
Right, and that's a great point. So there's definitely frustration. Folks that started October 1st that sort of got that website that said it's down, frustrated. If they tried again, frustrated. So we've been working with them to say, let's schedule an appointment to walk you through it. Do it during off times. A lot of times if you're going on during the morning or during the end of the day, that's when you're going to get most of the site traffic. But doing things on the weekend or later in the day after 5 o'clock, you can kind of get through. But to your point, the folks that need it the most will be the ones that sort of stay patient and consistent and persistent to get on. And that's the big worry, that the folks who need it will get it. And then the folks that sort of will get it for protection or security will sort of say, forget about it, I won't do it this year, or I'll do it later. And that would be troublesome for the administration if the sicker folks are the ones buying it more so than the other ones.
As I understand it, part of the existing problem that remains is what's called, back-end problems, and that is the information that is gathered by the website and then sent to the insurance companies. Sure. Tell me what you know about that.
Yeah, so that goes back to the federal hub. So whether you're a state-based exchange or a federal exchange marketplace, we rely on the website to make sure that they validate who the person is and send that information to the insurer. Prior to this, people used to fill out a paper application. What's my name, my address? Now you're getting that as an 834 transaction. They call it an electronic transaction. That can have hundreds and hundreds of information for that person. And there's a process of validating that the information is correct, it matches. And that's been a working issue, making sure that all the information comes in, it's processed correctly, it's processed efficiently. I would say, you're talking 10%, 12% of those 834s are having issues arise where you're making outbound phone calls to either the state or to the member to validate. But for the most part, they're coming in through smooth, and there's a companion guide that comes with it so you can kind of understand the data that's going to come through.
Before I let you go, remind people of the important deadlines now that are coming up.
Sure. So the new date now for getting coverage by January 1st is December 23rd. 8 more days than you used to have. And you can enroll through March 31st. It used to be February 15th to get coverage by March 1st, but now they say you can actually enroll all the way up to March 31st and still avoid penalties.
And that's to avoid the penalties on our tax returns. All right, Errol Pierre, you're always great at this. Thank you so much.
Not a problem. Thank you.
Well, I'm sure we'll talk again.
Good to see you.